Hi, everybody. This is Dr. Melissa, and welcome to Take Charge of Your Health. Simple steps you can do today to take control of your physical and mental health. And today I have with me Dr. Swathi, who is a medical cannabis expert and integrative health expert. And so we're going to talk to her and learn some simple things we can do to take charge of our health today. So welcome, Dr. Swathi.
Oh, thank you so much for having me.
Very good. So tell me, how did you get involved with medical cannabis?
Yeah, so I guess it all started back when I was in school. And so I'd always been interested in preventative medicine and plant medicine, natural medicines. But I didn't know anyone who was a pharmacist who did that until I had the opportunity to come out to LA for one of my clinical rotations. And I
Mm-hmm.
met someone who did that. And so she kind of became my mentor, and now we're colleagues. And since then, we've just been learning a lot about cannabis, and really a lot of it came from the demand. So it was twofold. So one part of it was demand, because so many patients were coming, so many practitioners were coming and asking us questions. So we wanted to be able to answer the question. So that was one part. Then the other part was just learning more about the plant. It's just so fascinating from a scientific perspective, especially if you like to nerd out on chemistry or anything like that. It's just such a fascinating plant, and you just learn more and more. Like every week there's always new research coming out, so it feels like it's an ongoing learning process too, so you're always interested in something.
That's awesome. And for those watching, people may not know that a lot of our medications, supplements, whatever, they start out as plants, right?
Oh yeah, a lot of them originally were plants. Like aspirin is a great example. Like it is originally, that was the idea, and that's where it came from. Of course it's not that way anymore, it's synthetic, but originally,
Right.
yeah. Hmm.
Exactly. Okay. So tell me a little bit more about your clinical background and kind of your experience there.
Yeah, definitely. So after I graduated pharmacy school, I had the opportunity to work at an independent natural pharmacy where I did some postdoctoral training in integrative health. So I was there a few days a week. And then apart from that, I was also at an HIV clinic. So that was also an integrative type of setting. So I was able to work with patients one-on-one by starting a medication therapy management program, which ended up being so rewarding because I could talk about normally medication therapy management when it comes to pharmacists is just looking at the medication list. And I mean, that's a lot in and of itself. But because I come from the integrative perspective and I'm trained in that, I have the perspective to like look at that list, but also natural products that they're on, dietary supplements. And I can recommend things like therapeutic aromatherapy. I can talk about sleep hygiene. I can talk about nutrition. So really looking at it as like the whole person perspective. So I trained there for quite a bit. Now since COVID, I haven't had a chance to be back at either of those settings for a while. But apart from that, I do a lot of teaching otherwise. We've always had students that have come through the rotation site. And so I've worked with students kind of like on 6-week basis or bases to like try to teach and give them the opportunity to learn about natural medicines, because unfortunately in curriculum right now, that's not a mainstay in pharmacy curricula, or really any healthcare professional curricula. So yeah, that's a little bit of background about that.
Okay, that's great. So you use the term integrative health, and you alluded a little bit, but let's break that down for people who are watching. Let's break that down. Exactly, what does that really mean when you hear the word integrative health?
Yeah, so I get this question all the time. And also I think that like from the Western trained practitioners, a lot of the time when I say integrative health, they kind of just assume that that means that I'm telling people to go like hop around in circles and smile and like do all these like kind of ridiculous things in place of their medication. So they think that I'm telling everyone to get off their medication. Whereas integrative health, from my perspective, is the combination and really the integration. I think it's very well named, the integration of so many different modalities together. And so that is like the combination of conventional pharmacotherapy, those conventional prescriptions, but then with the addition of dietary supplements, nutrition, and all those other modalities, including like homeopathy, Eastern and Western herbs too, and just looking at each patient individually and seeing which of the combination of modalities are best. There are some circumstances where the prescription is the best for them because they had XYZ event in their past, and that's what they need to do, like for example for a cardiac condition or something like that. But there are also so many other opportunities and preventative measures that we can take before it gets to that point.
Excellent. So what do you think are some of the challenges that face our healthcare right now that could really benefit from you?
I think there are so many challenges right now for so many reasons, but I think overall a lot of people's morale are just very low. I think that the use of integrative like methodologies when it comes to like mental health and mental wellness is just really important. So the importance of mindfulness, I think, is so underrated. We talk about that quite a bit with the students and like really trying to educate them about that. But even like with our patients too, that's something that we're talking about is, how can you incorporate mindfulness in any part of your life? It's not just, sitting as you see in like all like the beautiful images in this background. Ooh, did I lose you? No, okay. It's not like sitting out in like the beautiful background. You don't need that setting necessarily. So the idea of mindfulness and meditation, but in any setting, I think is really important. And then also just like maintaining a like balanced, healthy lifestyle. I think that that's something that a lot of people are dealing with right now too, just with like such a shift in their lifestyle and how they've been living their life versus now. So I think having strategies and methods to deal with that.
That's excellent. I read a statistic that a lot of high level performers and a lot of college students, and you work with a lot of college students, they turn to prescription medication to be able to study, to be able to sustain. And so talk about how this mindfulness, you talked a little bit about it, but let's expand on, especially for young college students, what is one simple thing that they could do today so that they don't have to go on that prescription medication?
Yeah, I think just having time with yourself. I think that there isn't enough emphasis in our society on self-development. So having that time, just spending it for yourself, like the self-care. I think self-care has this like connotation of hygiene. So if we want to talk about it like hygiene, yes, it is like physical hygiene, but it's also mental hygiene. So I think taking a moment, and everyone says they're all so busy and everything, they don't have time for it. I guess now is a moment where we maybe do have a little bit more time to focus on that. But either way, I think even starting with 30 seconds a day, a minute a day, like it doesn't have to be like hours and hours, it doesn't have to be a retreat type of a thing. I think it should be integrated into people's routine as like a moment to also with reflection. I don't think people reflect enough because I think a lot of so like, for example, like some of the mistakes that they've made or some missteps, like I think with some reflection, perhaps they wouldn't be repeated as frequently or like things like that.
No, that's excellent. That's very excellent. And, mental health has taken on, I think we're starting to hear it because there's some famous people starting to talk about mental health, but mental health is kind of always had this negative thing, this negative vibe. And I know that you're passionate about, helping mental health integrate with your integrative health and with cannabis health. So describe mental health, and let's say mental wellness instead of mental health.
Yes.
Because let's reframe. Let's try and take that negative away. So let's talk about that. How our mental wellness can be better.
Mm-hmm. Yeah, I love the idea of looking at it as mental wellness, because I also think like with integrative health, like integrative wellness is like a great way to think about it too, because we need that emphasis on actually like the process to being well and being well. And I think like the term well and wellness goes really well with preventative care. So I think that that should be the emphasis, and that should be the focus. I mean, it comes down to each patient and like what they prefer and what their lifestyle looks like, and really what their treatment goals are, and what like the way that they want to live their life if they're not living their life the way that they would like to right now. So I think that's a great place that practitioners can step in. Any sort of practitioner in any realm, I think, can be so helpful. But there also are like really good apps now. Like some of them are even free, or they have the first month or two that are free. Like now could also be a time to maybe look into something like that.
That's excellent. And yes, I think we spend our world a lot on our phone, and I think those apps are great. I have a couple that
Yeah.
I go through, and it makes a difference. It makes
Mm-hmm.
a difference, and that's something simple that you can just pick up, and just do quick.
Definitely. And there's also some universities like UCLA, UCSD, and those are just to name two. There's so many other universities now that have like a center for mindfulness research and that type of thing. So I don't want people to think that it's just like that there isn't any research or there isn't any like basis in what we're saying, because there is so much research being done now. And a lot of those centers, like for example at UCLA, every single week they have on Thursdays during lunchtime where it's a free guided meditation, and the entire auditorium gets full from 12 to 12:30. It's incredible to watch. And so I think there's also those opportunities too, like once we're able to go back into the public, like a bit more normal, or a new version of normal, that could be an opportunity too, to like do it with other people if you feel like you need a more of a community atmosphere.
That's wonderful. And I think, banding together is what we need. We need that connection. We're social by nature, and
Mm-hmm.
this social distancing has made it difficult for us.
Definitely.
It's not quite the same. And so, yeah, I think those are great. That's awesome. If they can fill an auditorium like that, that's just
Mhm.
wonderful.
Yeah, definitely. And then also with reframing, I started calling it physical distancing instead of social distancing, just so we don't take the social aspect out of everything, because maybe we are living alone, or maybe we haven't had a chance to see our family in a certain amount of time, but still having the element of being social, just not like physically social.
I love it. I love it. Physical distancing. I love that. Okay. So let's talk about maybe some specifics, and I'm sure you have some examples. We're not going to violate any HIPAA laws or anything, but give me some examples of how you would use maybe cannabis for mental wellness, for a particular,
Mhm.
maybe a particular indication within that mental wellness.
Yeah, so I mean, there's great research to support CBD, for example, and anxiety. So there were quite a few patients that came to, for example, like the HIV clinic, and that's something that they were struggling with was anxiety, and they were having certain side effects from their SSRIs or their antidepressant or anti-anxiety medications. So they didn't want to take them anymore, and so they were wondering, was there something else they could do to very safely like taper off that medication and potentially add something else? So I think in that context, CBD could be a great option depending on, of course, the patient. There are other diagnoses, there are other meds, and a lot of other factors. But I think, like as an overarching statement, I think it's a good option for some patients, for anxiety, especially in these times. So yeah, I definitely talked about that quite a bit. And then I think also with anxiety, a lot of patients are using that for pain too, a lot of like topical pain. So they're using creams and balms and those type of things, for any like joint pain. So that was something I also saw quite a bit in the clinic, is they were having a certain pain and they didn't know what to do. So I think there's some great homeopathic creams that I would recommend, but then also I think CBD, there's some really great products for that too.
Okay. So
Mhm.
because we're both pharmacists, and because we deal with medications and we deal with the supplements and the
Right?
CBD, let's just be, let's put our doctor pharmacist hat on, and,
Hmm.
and say that, CBD does have some interactions. And so what I want to I'm going to have you stress this, since you're you're the expert. But, what about just going to any mom and pop store? How do we know that we're getting a good quality product? And
Mm-hmm.
how do we know, that it's not going to interact? Because, I can just go down the street. I live in Colorado, so we've had both medical and recreational available for a while.
Right. Mm-hmm.
And, when you get to the, if I'm buying CBD, am I really buying CBD, or am I actually getting THC? So can you elaborate just a little bit on that?
Yeah, there's no real standardization or regulation right now when it comes to the CBD market. And so it's really, really hard to know whether it's a good product or not. A lot of the time, the products that I end up trusting are products that they have like a full-on list of everything, like all the different tests and everything they've done. Of course, then people argue, like, do you trust the testing companies? But at a certain point, I think that that's a decent thing to look at. And then also a lot of the brands that I'm most familiar with, I try to make connections with that brand. And then actually, like, there's some brands, for example, that in their customer service team, they have a like medical expert or medical representative. And so I serve as that person for a few companies. So if they also had some version of that, where if I had a medical question, I could ask someone, or if they had someone that with a medical background that was involved in formulation or something, I think that would be great. So just doing like a little bit of research, I think is very helpful. And then with drug interactions, so a lot of the research that's been done on drug interactions have been done on doses that are so high, like doses that no one is taking normally at all. And of course, a lot of these studies are associated with Epidiolex, the prescription medication for the cannabidiol oil for the rare childhood epileptic seizures, or epileptic conditions, sorry. So I do think that it is necessary to know as a pharmacist, as a healthcare practitioner, that they're possible. But the studies that have been done are studies with very high doses. I think if we're looking at the metabolism of like THC and CBD, for example, I think it's important to know, like, so CBD is primarily metabolized by CYP3A4 and CYP2C19. And so if the patient is on one of those medications, then I would probably recommend, depending on the doses of both medications and other diagnoses and other patient factors, I would probably recommend just spacing those medications out for a certain amount of time. But of course, it's patient specific, but I'm mostly overall not worried. There are a few like anticonvulsant medications like valproic acid and clobazam that to me are hard contraindications. But overall, I think it's pretty safe with the doses that people are taking overall.
That's good. And if people don't know what CYP3A4 and all that, ask your pharmacist. Or
yeah.
So, what about so let's look to the future. What are your future thoughts for how like our current psychedelic therapies that we're using for mental wellness? Where do you think that future is going?
Yeah, so I think cannabis falls into that category as well. So I really hope to see more people have the accessibility to medical cannabis, but even more than that, having the accessibility to knowledgeable practitioners, which is why I'm so passionate and interested in education, because I think, like, how is the patient going to know if their practitioner doesn't know? And there's so much great research that supports patient-practitioner relationship and how that impacts overall patient outcomes and all of that. So I just think that's so important. And then in terms of other psychedelic therapies, there's so many right now, like some that are being researched at Johns Hopkins. They have a full-on research institute for that. There's some really, really great studies going on in Toronto and other places as well. Those are the two I'm most familiar with. And so they're looking at things like psilocybin and ibogaine and MDMA and all these other possibilities, of course, with a practitioner involved, as an option for patients. And there are certain states that are taking really big strides, like Oregon, for example. They have a they have something coming up on the ballot in November to potentially be one of the first states to have a more statewide regulated psilocybin treatment through a medical practitioner, and they're putting together a task force and all of that. So still very much in the near distant future, not in the present or like in maybe not next year, but in the near future, definitely.
Okay. No, I think that's
Mm-hmm.
great. And I think, one thing for any practitioners that are watching, I think that it's very important that it's a cohesive healthcare team, that the patient's
Mm-hmm.
involved, that your pharmacist is involved, that your physician or your nurse practitioner or whatever your provider that you're seeing, that we're all on the same page, and that we can meet the goals of the patient versus just, okay, here, take this from the provider, basically old school. We've moved into this new age, and we need to kind of roll with the times. And I think healthcare has lagged behind a little bit. And
Yeah.
I love that you're out there doing this and promoting, because it's something that is very much needed.
Definitely. And we always say that the most dangerous supplement that a patient is taking is the one the practitioner doesn't know about. Because you never know, there could be so many drug herb interactions for certain patients and certain patient populations too. So like, I think things like that are so important. So I think when it comes to integrative health, when it comes to other like methodologies of medicine too, I think like that patient practitioner team is just so important, and looking at it as like a team. Like, we call it patient-centered shared decision making. So the patient is still in the center, but the decision is between the practitioner and the patient. And of course, like, compliance goes up with that. The trust level between the two goes up. The relationship improves. There's so many positives to that as well.
Yes. Oh, I love it. I love it. So I want to thank you for being here on this interview today. And Dr. Swathi has a special gift for you. So there'll be a link just at the top. So why don't you talk about your gift that you have for us?
Yeah, definitely. So I'd love to meet anyone and everyone who's interested in learning more about cannabis or learning more about integrative health. And if that's something you want to start incorporating into your life and into your regimen, I'm offering 25% off my first consult fee. So please let me know, reach out. Even if you just want to start the conversation and ask me a few questions, we can start there too. So yeah, I'm very excited to meet more people that are interested in this.
That's awesome. That's wonderful. Thank you so much. Thank you for being here. And if you've just tuning in, be sure you join us tomorrow. We've got another great speaker coming, learning more about how you can take charge of your health. So stay tuned, and we'll talk to you next time.